Aloha. In this video I would like to explore this question with you. Can big data analytics replace meta-analysis? Meta-analysis is a statistical technique developed by Dr. Jean Glass in the 1970s to systematically synthesize findings from multiple studies, providing a more comprehensive understanding of a research question. By combining data, it enhances statistical power, refines effect size estimates, and resolves inconsistencies across studies. This method has become a cornerstone in fields like psychology, education, and medicine. Notably, Dr. Jean Glass, the inventor of meta-analysis, is a member of my doctoral dissertation committee, making his groundbreaking work particularly significant to my academic journey. With advancements in data science, particularly big data analytics, some may question whether the merits of meta-analysis are being overshadowed. After all, while meta-analysis increases the number of observations indirectly by synthesizing multiple studies, big data analytics achieves this directly by working with large datasets. This video will explore the comparisons between the two approaches and offer recommendations. As mentioned before, typically meta-analysts do not have direct access to the original data from previous studies. Instead, meta-analysis relies on summarized findings, which can reduce precision. Furthermore, it assumes that studies conducted in varied settings and using different methodologies are comparable. For example, based on meta-analyses, the medical research community asserted that antidepressants are not more effective than placebos. But critics charged that not all the studies included in the meta-analyses use the same protocols, definitions, types of patients, and doses. The alleged safety of Avandia is another example. A meta-analysis from the combined trials showed that only 55 people in 10,000 had heart attacks when using Avandia, whereas 59 people per 10,000 had heart attacks in comparison groups. However, after a series of follow-up analysis, this conclusion was reversed. Siegfried argued that a meta-analysis synthesizing many small-scale studies is not a good substitute for a single trial with a large sample size. In addition, Slavin and his associates asserted that small studies are not inherently biased, but a collection of small studies tend to be biased. Thus, Slavin warned against reporting average effect sizes using a cluster of small sample studies. In contrast, while in big data analytics all individual data points are accessible, and the data are sourced from the same collection process, scalability is greatly enhanced. Specifically, big data analytics can process immense volumes of data, identifying trends and patterns that might be missed in meta-analysis. When data are collected using consistent methods, it eliminates the variability introduced by different protocols in meta-analysis. Big data analytics can provide ongoing, real-time, up-to-date insights, unlike meta-analysis, which synthesizes existing and often older studies. In the realm of classical statistics, usually the researcher investigates only a few variables in a conventional experiment. Afterwards, it takes a long time for meta-analyzers to synthesize the results. By contrast, data science is equipped with automated tools and can identify extensive numbers of correlations within a few minutes, thus reducing a vast search space to a manageable one. Hence, it becomes a means to accelerating discovery. For example, data science has been utilized to accelerate cancer drug discovery. In the Baylor-Watson study 240,000 papers were evaluated and in 3 months 2 promising drugs were discovered. Using conventional methods, such as systematic review or meta-analysis, the discovery process would have taken years, not months. Further, meta-analysis depends heavily on published studies, which are often subject to publication bias, selection bias, or both. Historically referred to as the file drawer effect, publication bias now manifests as the hard drive effect, or cloud effect, in the digital age, where unpublished manuscripts are stored electronically. This bias arises when studies with non-significant results are excluded, leading to a skewed representation of findings. These issues are further compounded by the interplay between publication bias and selection bias. Meta-analysis operates within a framework akin to the courtroom model, where evidence is selectively gathered to explain past events. This retrospective approach allows researchers to choose which studies to include in their synthesis, introducing an element of subjectivity. Using a gambling analogy, some people argued that conducting meta-analysis is like betting on a game after knowing the outcome. It relies on known data rather than an unbiased prospective methodology. In contrast, big data analytics focuses on predictive accuracy by dividing the large dataset into subsets, such as training, validation, and test sets. This approach aims to prevent overfitting the model to any specific sample. Nonetheless, big data analytics should not be treated as a replacement of meta-analysis. The limitation of meta-analysis is also its merit. Meta-analysis synthesizes results from studies conducted under different conditions, offering a broader and more generalized understanding of the phenomenon. Specifically, meta-analysis explicitly accounts for heterogeneity among studies, such as differences in populations, settings, and methodologies, by modeling variability through statistical methods, such as random effects models. Rather than viewing big data analytics and meta-analysis as competitors, they can often be seen as complementary tools. In summary, on one hand, meta-analysis is powerful when the goal is to generalize across diverse contexts and when raw data are inaccessible. On the other hand, big data analytics excels when large-scale, homogeneous datasets are available and granular insights are needed. Thank you for watching.